आगे बढ़ लेते हैं। एक नए रिसर्च से पता चलता है कि कोविड से बचे यूरोपीय और चीनी नागरिकों की तुलना में भारतीय लोगों के फेफड़ों को ज्यादा नुकसान हुआ है। यह रिसर्च जो क्रिश्चियन मेडिकल कॉलेज वेल्लोर द्वारा किया गया है। कोविड 19 के बाद फेफड़ों की कार्यप्रणाली और मानव शरीर पर क्या प्रभाव पड़ा है, इसी पर रिसर्च किया गया। मेरी सहयोगी स्नेहा ने रिसर्च के प्रमुख डॉक्टर डीजे क्रिस्टोफर से खास बातचीत की। आप भी सुनिए।
I'm being joined by Dr. DJ Christopher at this point, the principal investigator of this study. Thank you very much, Dr. Christopher, for joining us. Well, my first question, what are the key takeaways of this study, Doctor?
Well, the key takeaways, Sneha, are that patients who recover from COVID-19 don't recover with normal lung. They actually have some degree of scarring and residual damage, which may continue much beyond their acute illness. We do not know if they will, we know actually that they will never be, not all of them will ever become normal. In other words, some people are going to live with residual lung damage for the rest of their lives. So that is the key message. And also, what was concerning in our study is that the degree of damage was more severe in the Indian population than what we saw in the Chinese population and the European population. These were the two populations in which these studies have been previously done. So that was a bit of a concern for us.
Right. In fact, when I'm speaking to you, I myself seem to be coughing. I wonder if I need to be going to the test. And quite frankly, with the study, that seems to be one suggestion. But, is there any correlation between comorbidity and COVID in your study? Could you find anything during or pre-COVID, for that matter, with respect to comorbidity?
Yeah, well, we also demonstrated that our patients had much higher comorbidities than other populations. So in our population, an astounding 72% of the patients had comorbidities. So comorbidities include diabetes, hypertension, chronic respiratory disease. So in some ways, at face value, it looked like we had a sicker population than let's say, the Chinese study. So the average age of both the populations was the same. Their population also was 48 years, and ours also was around that. And their comorbidity was 40%, and ours was 72%. So in some ways, I wonder if that may also contribute to the worse lung function and other impact that our population had.
All right. Now, if you are saying that Indians are the most severely impacted, has there been any cross-country comparison study that this is being based on? Could you give us details about that?
Yeah. So we can only compare with published data. So at the time and after that, after about a year and a half, as we followed the literature, there have been studies only from China and from Europe. And our comparison is with this data. So compared to all the studies published, the degree of lung impairment as measured by sensitive lung function tests is significantly higher in ours. We had 44% showing impairment of what is called diffusing capacity, which is probably the most sensitive of the lung function abnormalities. And there are other things. There is something called restrictive defect, which is essentially a shrunk lung that was there in 35%, and obstructive lung disease, which was in 8%, is really a blockade in free passage of air into the lungs. So these were the abnormalities that we encountered in very late terms.
All right. Now, for our viewers who are listening to you, particularly those who have recovered from COVID, what would you say they should be doing? What should they do?
Yeah. So obviously they need to do annual checkups, particularly the elderly. So that's a given that everybody knows. In the context of this study, I would say that anyone who has had COVID, if they find that they have respiratory symptoms such as shortness of breath or cough, then it is good to go and get themselves tested. Now, shortness of breath in the early phases may not affect them when they walk around in their house. It may affect them when they climb up stairs, walk uphill. So if they find that they have limitation, it's not a bad idea to get lung function tested. So I would say, we are probably further down post-COVID now. And so instead of raising panic, I would say if anyone has symptoms, they should probably get themselves tested.